In this video you will come to know the prevention of diabetes through diet, exercises and yoga. Prevention of diabetes mellitus type 1 and type 2 diabetes. Blood glucose, or blood sugar, levels that are elevated in people with diabetes are chronic metabolic conditions that, over time, cause substantial harm to the heart, blood vessels, eyes, kidneys, and nerves. There are two ways of prevention from diabetes of all types, i.e., prevention of type 1 diabetes, prevention of type 2 diabetes, prevention of diabetes insipidus, and prevention of gestational diabetes. Medical nutrition therapy, MNT. Diabetes exercises and yoga. 1. Medical nutrition therapy, MNT. Medical nutrition therapy means nutrition-based treatment administered by a registered dietitian nutritionist. The most recommended food by nutritionists for diabetic patients are leafy vegetables and others, broccoli, spinach, asparagus, lettuce, etc. Vegetables, Indian squash, beans, bitter gourd, celery, bottle gourd. Citrus fruits, kiwi, cherries, apples, guava, grapefruit, berries, lemon. Nuts. Citrus fruits juices. Yogurt. Eggs. Fish. Whole grains. Wheat, brown bread. Oatmeal. Chicken. Mutton. Peppers. Olives, olive oil and mushrooms. Corn, barley, roasted black gram. If you have diabetes type 1 or diabetes type 2, then you can follow these recommended diabetes diet to maintain the sugar level in your body. 2. Diabetes exercises and yoga. Exercise helps to maintain high blood pressure, lower body weight, make muscles stronger, and give you energy. It is a way of prevention of obesity, which is a main cause of many diseases like diabetes, coronary heart disease, gallbladder disease, etc. Also, obesity causes many complications like high uric acid, high blood pressure, high cholesterol, breast cancer, colon cancer, etc. These are the exercises that are good for children and young adults and aged patients who suffer from diabetes. Walking, jogging and running, tennis, basketball, cycling. These are the yoga postures good for diabetes. Reclining bound ankle pose. Seated forward bend. Supported shoulder stand. Plow pose. Upward facing dog. Bow pose. Half load of the fishes pose. How to control diabetes at early stage. Diabetes prevention. Say no to sugar and refined carbs. Consuming foods high in refined carbohydrates and sugar raises insulin and blood sugar levels, which may eventually cause diabetes. Many morning cereals, white bread, and potatoes are examples of refined carbs. Limit your intake of sugar and go for complex carbohydrates like whole grains, vegetables, and oats. Stop smoking. Insulin resistance brought on by smoking can result in type 2 diabetes. Observe your portions. Reducing insulin and blood sugar levels as well as the risk of developing diabetes can be achieved by avoiding big meal sizes. Target 30. Strive to be purposefully active 5 days a week for 30 minutes by walking, dancing, lifting weights, or swimming. Ingest water. By substituting water for other beverages, you may be able to better manage your blood sugar and insulin levels and lower your risk of developing diabetes. You can avoid consuming alcoholic beverages that are loaded with sugar, preservatives, and other unnecessary chemicals by drinking water the majority of the time. Ingest fiber. Eating enough fiber is good for your digestive system and for controlling your weight. Each meal should contain a good dose of fiber to help minimize blood sugar and insulin surges, which may lower your chance of getting diabetes. Prevention of gestational diabetes. These are the ways to prevent diabetes in pregnancy. Divide your daily food intake into 3 meals and 2 to 3 snacks. Consume starches in moderation. Sip milk 1 cup at a time. Restrict your fruit intake. Breakfast is important. Limit sweets and desserts strictly. Avoid foods with extra sugar. Food to avoid in diabetes: sugar-sweetened beverages, potatoes, bakery sweet items, trans fats, white bread, rice, pasta, fruit-flavored yogurt, packaged snack foods. Flour: avoid fast food that contains flour. Sweetened fruits like banana, mango, pineapple, etc.